As COVID-19 spread throughout the country, the urban poor and rural agricultural workers couldn't get access to tests, vaccines, and life-saving drugs. A team from the Office of Quality Improvement at the Health Resources and Services Administration delivered over 20 million vaccine doses to communities in need. Suma Nair is the director of that office and led the effort. She's also a finalist for a Service to America medal. Suma, welcome to the program.
Great. Good morning. Thank you, Mimi.
So what was the problem? Why were those communities being left out as the vaccines and other supplies were being rolled out around the country?
Yeah, I think early on, the efforts were to get the vaccine out as quickly as possible to as many communities as possible. And large-scale mass vaccination events that were really helpful, but missed a segment of the population who perhaps couldn't reach those or were not comfortable engaging them. And so we saw early on that even in the vaccination effort for healthcare providers, health center providers were not being reached equitably and quickly. And they were, in fact, the frontline defense for many of our patients across communities. And so it was wonderful to have this direct allocation program that could get directly to our healthcare providers, protect them, and enable them to then work more slowly with the communities they had built trust with, set up events that supported access, not through an online portal, but in language, culturally competent, to get out to their patients, whether it was through community events, of which they did 10,000 or more, into homes, and bring people into their clinic to support them with getting the vaccine.
Suma, why would it be your office that would be responsible for getting help to those populations? How does that fit?
Yeah, we are part of the Health Resources and Services Administration, and our day job, if you will, is to provide grants to provide support services for robust, culturally competent, high-quality primary care. And so when we knew that we needed to distribute the vaccine, I think the administration came directly to us because of our trusted relationship with our 1,400 community health centers all across the country, so that they could leverage our knowledge of the systems, the health centers, the care teams, so that we could quickly get the vaccine out to patients and communities across the country.
Well, this project is obviously a huge task. Where did you start?
We started with what we knew already. We had a good amount of data over our years of working with health centers to understand the complexity of the patients, the communities that they served. And so we knew where to start in terms of targeting early on our first health centers with that focus on equity, individuals with limited English proficiencies, individuals experiencing homelessness, agricultural farm workers, residents of public housing. So we used the data. We also had systems through being a grant-making agency and working with our health centers that we had contact information, ways to communicate. Obviously, our routine communication with health centers would be monthly or quarterly. We were communicating with them on a daily and weekly basis throughout the COVID pandemic. And so we had to really ratchet up our IT systems, our communication vehicles, and the way we engage with our customers to have the bidirectional information changing. The nature of the pandemic was so dynamic that through each phase of the vaccine program, as we had more products online, we extended to different age groups, we had to make sure the information was getting out to our health centers and patients.
And in the beginning of this crisis, there weren't enough vaccines. So how did you prioritize where those doses would go within those communities of need?
Absolutely. I think we leveraged the information that we had about our health center patients and communities and focused on those who we knew were least likely to be able to engage in mass vaccination events and clinics.
And you also delivered about 50,000 antiviral doses. Talk about that process.
Absolutely. You know, it was wonderful to have another layer of strategy to mitigate severe COVID mortality and morbidity. So when the oral antivirals came online, we were so happy to get an allocation of those to distribute to community health centers. Again, so we know the pandemic was not equitable in its toll across communities across the country. So the communities that we serve were disproportionately impacted, and we were able to offer these therapeutics so they could prevent them from getting really sick and going to the hospital and spreading COVID further. And so it was really important to have that And then part of that, I think what we learned about therapeutics is the need to educate patients on the availability, what are the different considerations, and health center providers have that relationship with their patients that they were able to quickly implement the test to treat strategies. So we had testing kits available, tests on hand and if someone tested positive, they could quickly turn around and get the therapeutic that they needed within that 3 to 5 day window to support their recovery.
All right, Suma, thank you so much. Appreciate your work on this. Nice to be with you.
Thanks so much.
Nice to talk to you.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.